Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya. May peace be upon us all. Good afternoon, Mr. Hassan and friends. We are from Group B, consisting of Narasati Wiwi Prastini, Lucia Putri Natakusuma, Mareta Esther Kristiana, Melisa Fitriani, Niputu Maharani Maheswari, Nur Fadilah Ali, and Nur Sofia Azizah Syafri. In this good opportunity, we would like to talk about mental disorders, specifically about anxiety and depression. Our explanation will contain about the comparison between anxiety and depression, both the similarities and differences. The similarities and differences between anxiety disorder and depression disorder can be divided into its symptoms, causes, and treatments. And our group today will give you explanation about that. Let's begin with the explanation about what anxiety is.
You all must have heard of that anxiety. Even most likely we all here have ever felt that. But what about anxiety disorder? What is anxiety in the term of psychological mental disorder? According to UNDWK, anxiety is what we feel when we are worried, tense, or afraid, particularly about things that are about to happen or which we think will happen in the future. Anxiety is a natural human response when we feel that we are under threat. Most people feel anxious at all, but anxiety can become a mental health problem if it impacts your ability to live your life as fully as you want to. And what about the depression? It will be explained very good.
According to a non-profit American academic medical center that focused on integrated healthcare, education, and research named Mayo Clinic, on its website it is stated that depression is a mood disorder that causes a persistent feeling of sadness or loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. Also according to Mind.org, it is said that depression is a low mood that lasts for a long time and affects your everyday life. Depression can mean just being in low spirits. It doesn't stop you leading your normal life, but makes everything harder to do and seem less worthwhile. At its most severe, depression can be life-threatening because it can make you feel suicidal.
Okay, after we talk about the definition about both of anxiety and depression, we'll go on to the next part, which is about the symptoms of anxiety and depression. I'll go with anxiety first. The symptoms of anxiety are irregular sleep, lack of concentration, feeling nervous about one's future, and also anxiety can lead someone to depression. Second, depression. The symptoms of depression are irregular sleep, lack of concentration, feel hopeless, and also depression can lead someone to suicide.
From Sophie's explanation, we can see that the similarities of anxiety and depression symptoms are irregular sleep and lack of concentration. First, irregular sleep. According to one care media company called Sleep Foundation, serious sleep disturbances, including insomnia, have long been recognized as a common symptom of anxiety disorder and depression disorder. People who are plagued with worry often ruminate about their concern in bed, and this anxiety or depression at night can keep them from falling asleep. Second, no concentration. Poor concentration, lack of focus, and distractibility are also symptoms of anxiety and depression because your mind gets distracted when you have anxiety or depression. But also, there are some differences between anxiety and depression symptoms. People with anxiety will feel apprehensive and nervous about one's future and will have troubled thoughts. On the other hand, people with depression will feel hopeless and sad about the future and will imagine the worst scenario. Also, anxiety can lead someone to depression. Meanwhile, depression can lead someone to suicide. For the next, there will be an explanation about anxiety and depression's causes.
Okay, maybe you are here asking why this can happen. Why can anxiety or depression happen to someone? So, there are some most common factors that cause anxiety and depression. First, anxiety. The causes of anxiety are family history, trauma, stress, and drugs or alcohol use. And second, for depression, the causes are as well as anxiety, like family history, trauma, stress, physical illness, and medication. So guys, from the explanation before, we can conclude that there are a lot of similarities of anxiety and depression's causes. First, family history. People who have a history of mental health issues in the family may usually have problems with anxiety and depression. Second, trauma. A traumatic experience can have long-lasting effects. Emotional and psychological trauma can be caused by both one-off and ongoing events. A one-off event would be something like an accident, natural disaster, or an attack. And the third cause is stress. Stress at the workplace, loss of a loved one, and troubled relationships can also trigger symptoms of anxiety and depression.
But also there is a difference in anxiety and depression cause. Anxiety is also caused by drug or alcohol use. Meanwhile, depression is also caused by physical illness and medication, and for the next, there will be an explanation about how to treat this if someone has anxiety or depression.
Often depression and anxiety disorder can be treated similarly. Those treatments for anxiety and depression are self-help resources, taking therapies, medication, consider joining a support group, and try relaxation techniques.
We can see that the treatments are exactly similar. First of all, we can get the help researches. A self-help researcher might be the first treatment option because it's available quite quickly, and that's also a change because it could help you to feel better without needing to try another option. Second, taking a therapy to the therapist. Several forms of psychotherapy are effective. The example of cognitive behavioral therapy or CBT. CBT works to replace negative unproductive thought patterns with more realistic and useful ones. This treatment focuses on taking specific steps to overcome anxiety and depression. Treatment often involves facing one of fears as a pathway to someone recover. Interpersonal therapy and problem-solving therapy are also effective. Third, get medication. Medication can also be useful. Symptoms of depression and anxiety disorder also can occur together. And the research showed both of the treatment with selective serotonin reuptake inhibitor or SSRI and serotonin norepinephrine reuptake inhibitor or SNRI medication.
Besides clinical treatment, there are also other treatment steps such as support group and relaxation techniques. Support group offer people opportunities to attend regular meetings where people experiencing similar feelings and situations can offer support to each other. Members may share their experiences and coping strategies to reduce the feeling that they are alone. And the last is relaxation techniques. such as meditation and breathing exercise. When you feel stressed, your body responds by releasing hormone that increase your blood pressure and raise your heart rate. This is called the stress response. Relaxation techniques can help your body relax and lower your blood pressure and heart rate. This will help you to cope with anxiety and depression.
Okay, so guys, we are already at the end of the presentation. We hope this presentation gives insightful knowledge for all of us about anxiety and depression, so that we can work together for those who are struggling with these mental disorders, or even for ourselves. Before closing this presentation, I would like to quote a sentence from Cody Kaplinger. You cannot control everything. Sometimes you just need to relax and have faith that things will work out. Let go little and just let life happen. Thank you very much. See you next time, and wassalamualaikum warahmatullahi wabarakatuh. Shalom, Om Santi Shanti Om, Namo